Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, August 10th, 2021. And our top story today, American life expectancy drops significantly in 2020. Well, joining me now to discuss this and a lot more is Elizabeth Arias from the National Center for Health Statistics. Elizabeth, so great to see you. Thanks so much for joining us on the program this morning.
Thank you for having me. It's my pleasure.
Yeah, this is great. Yeah, it's great to talk to you and get into some of the weeds here or the details about longevity. And you and the team produced a report recently that really looked at, I guess, the impact of the pandemic on American longevity. What can you tell us?
Well, what we found was that the pandemic had a great effect on the overall health of the American population. And we use a measure, life expectancy, to assess the health of a population. And so what that estimate, life expectancy, told us was that the pandemic had a great effect. Basically, the number of excess deaths resulting from the pandemic led to a decline in life expectancy. And in other words, it led to a decline in the overall health of the population.
Well, Elizabeth, when I look into the numbers and the analysis that was done by you and the team, this is the largest drop in life expectancy since 1943. And what happened during that time? We had World War II, obviously a big commitment in human capital, human resources, a lot of lives lost there. What do you take away from this decline in 1.5 years thereabouts between 2019 and now 2020?
Well, basically, an easy way to understand what it means is that the increase in the number of deaths in this 1 year led to a decline in life expectancy of 1.5 years. And so what does that mean exactly? Well, think of it this way. Say you have a group of babies born in 2020, and throughout their lives, they were to experience the death rates that we saw in 2020. They would live, on average, 1.5 years less than babies born in 2019 that experienced the death rates of 2019. So that's how big of an impact the additional deaths from COVID were, basically reducing the life of a group of infants by 1.5 years.
Yeah, and that's, look, I want to live as long as I can. I think everyone around me wants to live as long as they can. And we had seen, I guess, before this, had we seen an increase in life expectancy? I think about my parents' generation. They're both in their 70s. And I think about my grandparents. They died into their 90s. We had seen really a nice upward swing. I think that's a result of good medicine, good technology, good taking care of ourselves, more awareness. But, you know, I mean, we want to live as long as we can.
Yeah, you're absolutely right. So historically, beginning with the early 20th century, life expectancy has been increasing almost annually. Now, the increases were larger during the first part of the 20th century because of the reduction in infectious diseases. And then during the second part of the 20th century, the increases continued, but at a slower pace. And that's mainly because most of the causes of death at that time and to date are chronic diseases that affect older persons. But in any case, we've seen an increase in life expectancy gradually almost every year until now. We've had years where life expectancy has declined, but the decline has been really small in comparison. So for instance, we've seen declines of 1/10 of a year, 2/10 of a year. I think the highest we've ever seen was 4/10 of a year. That happened in the 1990 due to the HIV epidemic. But this decline of 1.5 years, it's really unusual when you put it into the context of the history of life expectancy during modern times. So Going back, as I mentioned, to 1900, life expectancy for the US population was in the 40s, 50s. And so just throughout the whole 120 years, we've seen an incredible increase in life expectancy throughout that whole span of time. And now we see this big decline that we've not seen, as you mentioned, since the Second World War. And before that, the largest decline was due to the Spanish flu pandemic.
Yeah. And this was, if I understand correctly, this study was done, I think, looking at the mid-year of 2020. Is that correct?
Well, we've done both. So
Okay.
we first did a study that looked at the deaths for the first 6 months of 2020. And we compared the life expectancy based on those numbers of deaths to 2019. And at that point, life expectancy had declined 1 year. And then when the data was available, we re-estimated the life expectancy estimates using the entire year of 2020 mortality data. And then we saw that life expectancy declined by another half year. So in total, between 2019 and 2020, life expectancy declined 1.5 years for the total population. But there was a great deal of variation across different groups.
Yeah, and I want to get to the kind of the breakdown, the demographic breakdown in a second. But this new Delta variant obviously is ferocious. We've seen it in other parts of the world kind of rear its ugly head, and now we're experiencing in parts of the United States. Are there plans, or what would you anticipate? The virus is ferocious, but it seems like with the vaccine treatments, and we've got half of Americans vaccinated. I think 70% have had one. I could be wrong on the numbers. You would know them probably better than I would. But you had 70% of people maybe who have gotten one of two shots. But has the death rate would you expect the death rate to go down because of the vaccinations and the awareness of people to say, okay, I'm not going to go to ball games. I'm not going to go to a club. I'm going to stay outside. I'm going to stay away from people, mask up, and do the right things to prolong my life and hopefully prolong the life of others.
Well, hopefully that is the case. So far in 2021, as of mid-July, we have seen over 215,000 excess deaths or additional deaths due to COVID. The number is not as high as what we saw during the first half of 2020. But beyond that, I don't know. I mean, hopefully, if, as you suggest, people go and get vaccinated and we reach herd immunity, we will likely see a lot less numbers of deaths than we did in 2020. So if that's the case, then we should see a slight increase in life expectancy in 2021. But if we see a different scenario where the numbers of deaths continue to increase and match what we saw in 2020, then we will most likely not see any change in life expectancy. It'll still be, lower or like lower than what we saw in 2019. So it all depends on what happens between now and the end of the year. If we have fewer deaths than we did in 2020, but in any case, we will have an excess number of deaths also in 2021 in comparison to 2019.
Yeah, well, I mean, I think people are becoming more and more aware, through shows like this, through the information you and your team are providing. Elizabeth, I need to go to a very quick break. When we come back, we'll talk more about longevity and its impact to a lot of things in our society. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score, a credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're talking to Elizabeth Arias from the National Center for Health Statistics. Elizabeth, thanks so much for staying with us this morning.
Thank you.
Yeah, really interesting data, really important, and like I said on the outro, brings a lot of awareness, I think, for people of what they need to do, take the steps possible, and what the impact of a pandemic like COVID has in just 1 year, year and a half, has an impact on how long we're going to live and how long someone can expect to live when they're just born. Elizabeth, I want to talk to you a little bit about just longevity in general, because up to this pandemic, going up and up. And as you said, I mean, we've been able to mitigate some of these health risks. We saw the expulsion of the Spanish flu. We're not really in a lot of war conflicts and things like that, although things do pop up. But living longer has an impact. It means that we're going to be retired longer. It means that there'll be higher health care, potentially higher health care needs and long-term care needs. Just want to get your assessment on, have you and the team thought about, or have others within your community thought about the impact to living longer?
Well, what we do is we produce the estimates that tell us the average life expectancy of a population, also what proportion of the population will survive to different ages. So we estimate the proportion surviving to age 50, age 65, age 85, to age 100. So what we have seen over time, with the increase in life expectancy, we've seen an increase also in the number of people surviving to older ages. So, for example, over 50% of people survive past age 65. So that's the type of information that we provide, but we can't speak to the impact of that on society. That's for others to do.
Yeah, I mean, and who's to say what that impact will be? But I'm just thinking about some of the social trust funds, Social Security, Medicare, et cetera. Are there certain demographics that were particularly hit hard when it comes to life expectancy, whether it's mature? I know early on in the pandemic it was identified that maybe people who were older had comorbidities, they were going to be impacted a lot more, and therefore they needed to protect themselves. But when you look at you and the team look at the demographics, what does it tell you?
Well, the thing that stood out the most was the really large disparity between race and ethnicity groups. So we estimated the life expectancy estimates for three of the major populations in the country, and that's the non-Hispanic white, the non-Hispanic Black, and the Hispanic populations. And we found large differences between them. The in the effects of the COVID pandemic, for example, life expectancy declined by 3 years for the Hispanic population, by 2.9 years for the non-Hispanic Black population, and by 1.2 years for the non-Hispanic white population. So there were really large differences in the effects of the pandemic on life expectancy.
And a lot of that might have to do with health, overall health of the population, and also how people took care of themselves and where they were living. I mean, there's a lot of factors that go into lifespan. I mean, you got to think about, we all are individuals, but when you group people, we might live in different types of communities. Some may live in more urban areas. I mean, is that your sense that environmental factors, outside of just the pandemic itself and getting COVID, they have a direct impact on someone's overall lifespan and longevity?
Yes. One of the most important risks are socioeconomic status, which includes, for instance, income, education, occupation. So, for example, in the case of the pandemic, we had some segments of the population that were able to stay home and telework. And that was due to their occupation. Some occupations were possible, like mine, for instance. I was able to stay home. But there are others that could not. And so people that work in the service industry, people that work in supermarkets, for instance, people that work in hospitals, those were at greater risk of being exposed to the virus. And so we see, for instance, when you look at the Hispanic population, that it has great proportions that are in these types of jobs where they are at greater risk of being exposed because there are jobs that they couldn't do remotely from home. So that was one of the larger factors in the differences between the groups.
Yeah, it certainly makes sense. I mean, if you are more prone to working in a position where you are doing physical labor or have to be on site somewhere, you're going to be more vulnerable, and therefore you would see, the death rate or the longevity kind of decrease. Elizabeth, when you look out in terms of planning for future analysis for the remainder of 2021 and probably into, I would think, I mean, you're doing the study annually and you've been doing it for quite a long time. Not you per se, but I mean, the center has been doing it for a long period of time. What are you going to be looking at, and what kind of data are you going to be going through for your next set of reports? I mean, and also, where can we get the latest information from you and the team if we want to consume this information?
Well, the data that we use is basically comes from death certificates. So whenever someone dies in the US, the death certificate has to be filed. That's the law in order to dispose of a body. That gets registered at the local level, that goes at each state. The state collects that information, and then under a cooperative agreement with the federal government, with us, the National Center for Health Statistics, that information is sent to us, and we analyze that information. And that's how we're able to produce reports about the mortality status of the US population every year. And we produce things like life expectancy estimates. the leading causes of death, death rates, and we produce these reports every year based on the deaths that occur in a particular year. So for 2020, we have published information based on what we call provisional data so far, or preliminary data. Once that data is finalized, which will be before the end of this year, we will produce another report based on the final data. And by final data, that means data that we have evaluated for any errors, and we feel confident that is of the best quality possible from which to produce these estimates. And we do this, we'll do it all over again for data for this year, for 2021. And so basically, we produce various reports, a general report that includes several different types of estimates about mortality in the US, specific reports that are just about life expectancy, like this provisional one that we just published, another report that just deals with the causes of death in the US, the leading causes. We focus on the 10 leading causes of death. So that's how we produce our data and our information, and we publish it every year.
Yeah, well, I mean, it's so vital, and I think it gives insight into a lot of things about what's happening in American society, not forgetting the pandemic. Elizabeth, we're going to have to leave it there. Thank you so much for joining us. Really interesting. Thank you so much for all your work and your analysis, and we look forward to having you on the program again very soon.
Thank you. I really appreciate you having me on the program.
Thanks, Elizabeth. Great to see you. Thanks for sharing your perspective. And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the information in retirement markets technology, healthy aging, and so much more, check out today's edition of our daily newsletter, The Morning Pulse. We're back again tomorrow, so until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
But if you're tired of the same old stuff.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.